being able to open up and put somebody on a heart-lung machine, allowing us to stop the heart just to work on it. The whole concept of it still, I still think of, wow, well, this is the walk on the moon. You know, I'll never get to walk on the moon, but imagine that feeling every day if I get to step out and step on the moon. I've been at Luke's 7 years. My wife and I moved to the area in 2003. I couldn't ask for greater people to meet during my visit, and that was really the first big draw. Location was very important. I grew up in Yakima, so I was used to the high desert, used to this kind of climate. I wanted to be closer to home, but not quite back in Washington, and this was a great fit. But it was the people that pushed me here. The conduct of the operation since I started to now has gotten more efficient. We are able to do more in less time, but more importantly than that has really been, and what I'm most proud of, is watching the quality that's reflected by just outcomes. Looking at what is the mortality rate of a patient who comes through the door now, knowing that our patients are older, they are sicker, they have far more problems today than they had 5, 10, 20 years ago. A lot of patients who were not even candidates for heart surgery 10 years ago are still candidates now. So our outcomes are just getting better and better year after year after year, and it's a wonderful thing to be able to tell a patient your risk of major risk of having this operation is the lowest it's ever been. What Luke's has is the history. They started it, it's been going on for 40 years, and they've got the commitment for quality and the commitment to move forward. Sometimes the things that slow us down are not St. Luke's. It's the surgeons wanting to go down a road, a new technique, a new thing. They want to test it. They want to let it be trialed before they incorporate it into their already successful practice. There's a lot of things on the horizon. There's valves that are being put in now without the heart-lung machine. There are robots being used in the operating room. But we have to be careful to critique each procedure that's on the horizon and say, how does it apply to the patients in the Treasure Valley? Is it safe? Who gets it? Why do they get it? What's not holding us back is St. Luke's. My job is to take the program as it existed in '03 and take it as far as I can take it, and then hand over the keys someday later. But it's going to take philanthropy. It's going to take me engaging people who are willing to listen. Private industry. I'll sit one-on-one someday, hopefully, with somebody who wants to hear what we have to say and just say, here's where we want to be. We need to show them what we're going to do and why we want to do it. But the only way to take the Treasure Valley from an A to an A+, from a healthcare perspective, is a community effort.